You know, when you're facing a cancer diagnosis, the amount of information coming at you can feel, well, just overwhelming. But what if some of the most exciting new research wasn't about some brand new, complicated drug, but about things you might already have in your home? So today, we're going to dive into some of these unexpected allies that are popping up in the fight against kidney cancer.
I mean, it's a pretty wild question, right? Could things that are already sitting in your medicine cabinet actually play a role in improving cancer outcomes? It sounds almost too simple, but believe it or not, a whole wave of new research is looking at how common, everyday substances might just support and even boost conventional treatments.
Okay, so before we go any further, I have to say this, and it's really, really important. What we're talking about today is emerging research. This is absolutely not medical advice. Instead, I want you to think of this as fuel for a really productive, informed conversation with your doctor. That's the goal.
All right, so our first unexpected ally comes from the world of allergy medication. I know, right? By digging through massive sets of patient prescription data, researchers stumbled upon this really surprising link between common antihistamines and better outcomes for kidney cancer patients.
So just how big of a deal was this finding? Well, a major study in Scandinavia, and they looked at prescription records over several years, found a 30% lower mortality risk for kidney cancer patients who had been prescribed antihistamines. And the research even got specific, pointing to a drug called desloratadine.
This quote right here, it just perfectly captures where the science is at this very moment. Researchers are calling it a compelling case for further studies, and that's the key phrase. It's incredibly promising, for sure, but it's also a clear signal that this is an active investigation, not some ready-to-go treatment.
So where does this fit into the bigger picture? Well, the research suggests that these antihistamines might actually boost the power of immunotherapy. You know, those incredible treatments that help your own immune system fight cancer. Get this, one trial showed that when combined with immunotherapy, these drugs could cut mortality risk by up to half. That is a huge potential impact.
And it turns out antihistamines aren't the only familiar drugs getting a second look from researchers. Not even close. Two others you almost certainly know are also showing some pretty surprising potential: good old aspirin and statins.
A large Italian study looking at over 1,000 patients on immunotherapy found some fascinating connections. For the folks taking aspirin, the treatment was almost 50% more likely to work effectively. And for patients taking statins, their overall mortality risk dropped by nearly 40%. So we're talking about two very different but equally powerful potential effects.
Now, to really wrap your head around the potential impact of statins, just look at this chart. A study of patients with advanced kidney cancer found that the median survival for those taking statins was nearly 35 months. For those not taking them, under 19 months. That's a difference of more than a year and a half. I mean, that is a massive gap that researchers are now working hard to understand.
And the research doesn't just stop with repurposed drugs. There's a whole world of other supportive avenues being explored. So let's do a quick lightning round to see just how diverse these investigations really are. The range of what's being studied is just incredible. Could vitamin D3 supplements help? Well, one study found it nearly halved the risk of progression. What about something as basic as sodium? Higher natural levels were linked to a nearly 10-fold increase in the odds of a complete response. They're even looking at lactoferrin, that's a protein found in milk, which helped a quarter of patients in one trial live beyond 30 months. And even the mineral selenium is being studied, showing over a 55% response rate in a pilot study. The possibilities are truly all over the map.
So what is the takeaway from all of this? What are you supposed to do now? Well, it's definitely not about running out and self-prescribing anything. No way. The real power of this information is that it allows you to have a better, smarter, more informed conversation with your oncologist.
So here's a simple little framework you can use. First, dig a little deeper into any of the studies that kind of resonated with your situation. As you're doing that, just jot down any questions that pop into your head. And finally, bring those questions to your oncologist. This isn't about challenging them, it's about partnering with them. It's about using this knowledge as a tool to work together on your care.
And we're going to end on the most important point of all one last time. This is information, it's not medical advice. The whole goal here is to empower you to actively engage and work closely with your medical team. Because at the end of the day, the best decisions for your health are always the ones you make together. Thanks for listening.